as the committee is aware, my undergraduate work was in a Quaker college, and I find silence really very comfortable. But that doesn't always work for everyone, so I think, Jennifer, you've had a couple of questions that have been kicking around for a while, so why don't you start us off?
Yeah, I'll just kind of get the conversation started again. I'm with the Institute of Medicine News Office. The report calls for several recommendations for more research, as you guys laid out in your presentation. Can you talk a little bit more about what we do know about concussions?
Thanks. Fred, Art, one of you want to start?
Well, I think I mentioned some of them. One, we know that, first of all, concussion is a biological process. It is a head injury. It's a mild injury in and of itself, but it has very significant consequences if not treated appropriately. And that sometimes, I think, is part of the problem with the cultural aspects of it, because by itself, 90% of people recover without any intervention, but if it's not dealt with appropriately within those 2 weeks, there could be some very significant consequences to it. So we know that, and we know that getting that second concussion is potentially lethal and definitely causes more serious consequences. We know that more is not better. We know that what we don't know is what the timing should be, but that when you start to accumulate a number of concussions, the risk of another concussion and a more serious concussion starts to go up. So more is not better in this realm.
Fred, any additional comments? Okay. Yes, sir. Please,
Tom
again.
Here with the Daedalus Center for Sports Injury Research and Prevention. One of the things I was surprised to see missing from at least the summary report was a recommendation on how to evaluate or assess concussion in youth athletes. I'm talking younger than high school. For example, we're just in the process of finishing up the second year of a 2-year planned study in about 2,000 youth football players, where we're able to provide athletic trainers to 12 different communities in 6 different states around the country. And we contracted a qualitative researcher to debrief the athletic trainers that were working with the youth following the first year of the study. And the common theme from that assessment was that the athletic trainers had no idea how to assess concussion in a 5-year-old or a 7-year-old up to 14-year-old. Because if you ask a 5-year-old, do you feel nauseous, which is one of the common symptoms we often ask, you know, their parents may call it a bellyache, or they may call it vomit, or other things. So the challenge for these athletic trainers, and I'm an athletic trainer myself, was that they just didn't know how to ask appropriate questions to the youth. And it's rare that you have athletic trainers working with a young population like that. But even up through middle school or high school, that may be an issue where the ability to assess concussion effectively may be challenged.
Okay.
I don't know if the committee had any thoughts on that.
Thank you. Tracy, you want to start?
Thank you. So I am also an athletic trainer, so I understand what those athletic trainers are going through when they're trying to figure out how a 5-year-old has a concussion when we're used to working with collegiate or high school athletes. In our second recommendation, we did indicate that the National Institute of Health and the Department of Defense should support research to establish objective, sensitive, and specific metrics to pretty much diagnose a concussion and look at recovery in youth. And then the second part to that was to have these two institutions look at the creation of age-specific, evidence-based guidelines for the management of short and long-term concussion in youth. So in that recommendation, we constituted youth as all the way down to 5 years old, all the way through the spectrum up to 21 years old. So in that actual specific recommendation, we are recommending that NIH and Department of Defense actually look at examining how we diagnose a concussion in youth athletes and how do we monitor them and how do we follow their recovery. And that would include, hopefully, developing some age-related assessment tools so that we can have a better understanding of what exactly is it that we're supposed to be asking these 5, 6, 7, 8-year-olds. What exactly is it that they understand? You know, I work with high school athletes, and one of the symptoms is fatigue, and some of the high school athletes don't know what that is. So when you ask a 5-year-old, they don't know what that is. So we need to develop these tools that are geared towards the younger population.
Art?
Well, you highlight what we didn't find because there's no evidence, and so we're kind of waiting on your study. We would love to have seen it, and that's a significant problem. We do, in the report, go through the tools that are available, and there are a couple of tools for younger kids that seem to have some good psychometric properties and things, but constantly we came to this place where we had to say, there's just nothing about kids. It's really a huge gap in the knowledge, and I think we felt consistently that this has to hit home. We have to start doing better studies for the younger kids. So appreciate your work in this and looking forward to the study.
Fred?
I think it's really a very important comment, is that there's essentially nothing known about concussions in elementary school and middle school age kids. And that's really why there's a need for more research in this area. It probably makes sense to everyone in the room that guidelines for college kids don't apply to 5-year-olds. That's why we need the research.
Okay, thank you. Other questions or comments?
We actually have a question from the web. They ask, how would you measure a successful concussion management program in a school?
Art?
Well, we don't know how to do that. A couple of things are out there now, and we just concluded one study that's not yet published, so the committee really couldn't review it. But since we don't know what a concussion really is, it's hard to know when it isn't and what recovery is. But sort of the way I think most people are thinking about it now is number of second concussions that occur, especially within the first month or two, is a suggestion that maybe they really weren't recovered. But it's a very difficult, I mean, we're really more into sort of system of care issues, and there's absolutely no published study that we could find that talked about large-scale programs. And in fact, one of the things that I noticed in the literature is that there's more research related to, targeted studies and doctor visits, emergency room kinds of things, and some of these larger scale programs in high schools really haven't been looked at for their effectiveness, and they really need to be. So again, it's a huge gap in the literature that needs to be addressed.
I guess I might add to that. Go ahead if you're ready to go to the microphone. The question kind of takes us in a direction that I think is very consistent with the first recommendation, is a lot of what's in the literature right now is numerator. Incidents in this population, this study. We don't really have what we need in terms of denominator. So one of my criteria for a successful program in a high school or any other type of institution is the fact that somebody in that institution is starting to think about the whole population and starting to have a mechanism whereby they can do an assessment of where that population is at a given start point, what they encountered, what the incidence is of injury, how they recover, what the incidence is of seconds. So I think the question sort of goes towards how do you start thinking about managing and identifying this on a population basis, and that would be an element of a successful program to me. On that microphone, I don't know whether you have a question or comment on that last one.
A question, just a bigger picture question for parents.
If you could identify yourself.
Oh, I'm sorry, Beth Parker from Channel 5 News here in DC. For parents who are trying to digest all of this, can you give sort of, in a nutshell, some advice, having looked at all the research that's out there? What would you say to parents?
I will defer to the parents on the panel. Fred?
It's a very good question. I think what we can say is that concussions are a potentially serious injury, have potentially serious consequences, that encourage your child to tell you if you have symptoms. If the child has symptoms after getting hit in a game, they need to tell the parent, they need to tell the coach, they need to sit out. That the parent should realize they should take the child to a qualified healthcare provider who understands concussions and can make good recommendations about what kind of care, what kind of length of time to stay out of play, how to return to school.
Tracy?
I also think it's very important for parents, school administrators, athletic departments to also be educated on the signs and symptoms of a concussion and the serious consequences that can result if an athlete continues to participate. So I think one of the things that parents can do is not only be supportive when their child has a concussion, but also learn about what a concussion is and learn about what are the warning signs of a concussion so that they are able to recognize if their child doesn't realize that they have a concussion, then the parent can recognize that they may possibly have a concussion and then go to a healthcare provider to make sure that the child is okay.
Christy and then Art.
I think another thing parents can do is to make it their responsibility to understand the coaches and leagues of the activities that their children are participating in. Make sure those leagues have a return to play protocol and follow it. Make sure that those coaches and leagues have that education that Tracy just spoke about. It can be the parents' responsibility to ensure that those that are surrounding their children are as educated as they can be.
Art?
Because so many concussions resolve without any direct intervention, parents often think, well, then we don't need to do anything, and that might not be the right message. There isn't a lot of evidence yet, but paying attention to your child for, are they different? Are they acting different? And checking in with schools and teachers. Do they seem different in the classroom? Can be really important. There really isn't any way to know what to do, but in some ways it might be more important what not to do and what kinds of things you can engage your child in when they are recovering that don't make things worse. And so paying attention to, if they're staying up late at night studying and not feeling any better, that's probably not a good thing to be doing, and getting support for the schools. And we find that the schools are becoming more and more supportive of managing and monitoring and reducing workload, but that's an ongoing challenge, is to get them on board. So getting to your schools and to recognize that the concussion itself has potential serious consequences, and just like pushing through in sport, pushing through in academics can potentially be just as problematic and maybe more problematic. Again, the data's not there, so we couldn't really comment on it, but it's that common sense principle based on the things that we do know. So I always tell parents, pay attention. It's really important to pay attention to your kids.
I guess the only thing I would add to that goes back to our culture recommendation. Parents need to be sensitive to what the culture appears to be of the team or the sport that their child is participating in. And if they get the sense that that particular coach is not sensitive to these issues, is asking the child to do something that may not be comfortable for the child or may look like they're trying to overlook that, the parent needs to say, no, that's not acceptable. I know this is serious, and I want a different reaction.
Just want to add one little piece to that we haven't brought up today about culture, and that is the peer culture. So it's not just between the parents and the child's perhaps resistance to report their changed status and feelings, but there's also an aspect of peer pressure. And that culture can be addressed now. We don't really need to wait for that. So that can come from the parents, that can come from the coaches, but that can come from the athletes themselves.
Other comments or questions?
We have another question from the web.
I'm glad the web people are really active this morning.
They are. Actually, we have a number of questions. Again, this is about culture. Are we looking at a trajectory of culture change similar to the ones of heart disease in the 1950s? That is, it will be shown to depend so much on lifestyle choices.
If the questioner was present, I would ask them to say a little bit more about that. Certainly what we went through with heart disease is the understanding of prevention and, different types of behavior, different types of lifestyle choices. So if that's what they're getting at, I think we are talking in the cultural recommendation, changes in attitudes not only in the part of the participant, the youth themselves, and making different choices, whether it has to do with the style of play, the types of sports that they choose to play, how they protect themselves as they participate, but also the understanding, as Susan pointed out, that they have with their peers. What are we as a team? How do we look out for each other? Other thoughts on the panel that I may be missing there? Art?
I think it's important to recognize that we're not saying that we should stop playing sports, that we need active lifestyles, and what we want to do is make it safer. So any changes in lifestyle should not include reducing the amount of physical activity kids get.
Good. There are definitely risks for sedentary lifestyle, and that was true with heart disease too.
We have another web question. Is there research that evaluates how well coaches are following the return to play guidelines after a child has a head injury? And also, are there interventions that physicians may be able to provide to them?
Fred?
The answer is no. There really has not been research to date published on how well coaches are following the return to play guidelines. There are laws now in nearly all states governing this, but the evaluation of that has not happened.
I thought you were going to get up. Captain, to the microphone.
Good morning, Rita Shapiro, and I'm from Defense Center of Excellence. I have a question built on the comment that was brought up about coaches and, we're all talking research, but while the research is undergoing, is there a thought, did the committee think about how to educate, in culture change? Yes, we talked about students and the, children, but parents. But what about coaches and the trainers and the perception of sport that, yes, bigger, more impact is better? That seems to be quite prevalent lately. Did committee think anything about that? Or like a national level campaigns on injury prevention and skills building rather than impact?
Okay, thank you. Tracy, you want to start?
I think the culture change for coaches needs to continue to occur when we talk about sports-related concussion. So when we think about 10, 15 years ago, there was a culture in heat illness where we restricted athletes from getting water. And if you did well at practice, you're allowed to drink water. Well, then people were dying of heat strokes, so we changed the culture and now allow those individuals to get water whenever they can. I think we need to have that same type of a change for the culture for coaches. I know that I do work with coaches, and some of them are fantastic when it comes to sport-related concussion, but I can also tell you there are still coaches that are out there that believe exactly what you said, that bigger, faster, stronger, and don't be a wimp, get out there and play. And I think what we can continue to do is educate the coaches on the signs and symptoms of concussions, but also explain to them that concussion is a brain injury. You only have one brain, and you need to be careful with it. You cannot be allowing a child to hide their symptoms as a coach and not tell a healthcare provider and not tell the athletic trainers or tell a physician. So I think with more education, we need to change the culture of what and how coaches feel about concussions. So I think we've made some changes. I don't think we're there yet. So exactly what you said, I still think there are coaches that would rather hide that athlete to continue them to allow them to play because they want to win at all costs.
Got Susan and then Christy.
From our review of the literature and through our 2 public sessions, it was clear that the effectiveness of education was not really being assessed. There are a number of things that are being tried, but it was clear from our public sessions and our reading that sometimes it was implemented in a very cursory manner. The educational component might be something that was handed out without actually ensuring that there was any learning that was going on there, as well as not actually reinforcing it later in the season. So it's not enough to check the box. What we're talking about is effective educational methods to change the culture. And it wasn't for the committee to evaluate which methods might be most effective, but we actually recommend that those who are at this interface should be evaluating whether their methods are effective, and if not, try it something else, another method.
Christy?
I think the number of questions around this issue illustrate how complex it is. And I think whenever we're thinking about how to change behavior, there's social science theory that goes from education to knowledge to behavior. And the science that recommendation 6 speaks to needs to make those connections across a diverse set of actors, parents, coaches, teachers, athletic directors. And so those links need to be studied and evaluated to make sure we go from education to actually changing behavior, which is the goal we're trying to reach.
Yes, sir.
Hi, I'm Chris Gorski from Inside Science News Service. I know in the report you talk about the rules and the sort of rules such as body checking in hockey and those kind of things. I was wondering if there were any more specifics from other sports you could talk about that seem to be good interventions to reduce risk.
Fred?
I don't think we found any other studies that have really looked at the effect of rule changes. And I think that was really the point of the recommendation, was that there probably have been rule changes that are effective, but those need to be analyzed and looked at so we can really tell which are the rules that make a difference.
Other questions? Here comes the web again.
Yep, we have another one from the web. The concussion rate for high school football players is nearly twice that of college football players, according to the study. Any thought of why high school players are more vulnerable?
Tracy?
Well, right now we have found that there is a higher incident of concussion at the younger age, at the high school level, and that possibly could be due to the development of their brain. In that age population is more vulnerable to concussion. They also, what the committee has found is that the younger the athlete, at least at the high school age, we don't know anything below the high school age, but the high school age athlete tends to take longer to recover from their concussion.
Fred?
The other thing which we don't really know is what's the reporting bias. Are high school kids more likely to report their concussions than are college kids? Similarly, the data seem to indicate that there are more concussions in girls than in boys, but again, we don't know if there's a reporting bias there as well.
Art?
So this isn't in the realm of empirical science, but in the schools I work with, I am finding that the high school trainers are erring on the side of caution. They've sort of gotten the message, and so there could be some over-identification going on as well, just to be safe, because it is difficult to know, and so often they will decide to treat it as if, because they're not sure, but they'd much rather be cautious and conservative than to say, no, you're okay, and go back to play. So it might be that the education is paying off, but I have noticed this trend, and yet there is no real firm evidence on this yet.
And Susan?
I think there could also be a parental factor. The high school students are in the home setting. The college students are not in the home setting. So in terms of someone else making observations and helping the athlete seek attention. That may play a role. But it does bring us to our second recommendation, which is that we need some metrics that are objective metrics that you can be used in children over a variety of ages to detect whether or not a concussion has occurred, because without that, we're reduced to just having a self-reporting or more subjective metrics that depend on the athlete's willingness to participate and at their best effort.
All right, we're at 2 minutes until the hour, and Jennifer, I think you wanted to close things out. So on behalf of the committee and Dr. Rivara, the vice chair, I would like to thank all of you for your interest and participation this morning. For all of you on the web, thank you also for tuning in. I hope you find some of this to be helpful. For those of you here who are very shy and didn't want to ask questions, the committee will be around after we break in case there's some one-on-one discussion you'd like to do. Jennifer, back to you.
I'm just going to ask one more question that we received from a reporter from Neurology Today, Kurt Sampson. He asked, there seems to be a lot of clinics advertising for walk-in baseline concussion testing for kids. How valuable or appropriate is this given the lack of data, and what are they measuring exactly at these clinics?
Okay, my experience is the question you get asked when you think you're done with a hearing is the most dangerous one. So whoever would like to respond to that.
Well, he's correct. The evidence is mixed on this, and so we have studies that show that using baseline testing is effective for identification of concussion, and then there are studies that show that it's not, that you don't need the baseline in order to use a neuropsych test. You can just use normative standards. So I think the answer is still not in. They are expensive, costly, difficult to do. But from a sort of common sense clinical research perspective, you always want a baseline to compare to. So particularly when you're dealing with children who are not typical, who have learning disabilities, ADHD, other conditions that might make their baseline not be in the strictly average range. So you get more specialized information on individuals. So that there are arguments that go both ways. I can't say that we have a firm answer on this question, and if a program decided not to use it, I don't think they could be criticized for going against the science, because the science is not settled yet.
Okay. Do you want me to close it off, or did you want to do anything more? Okay. I am now in the position to say thank you very much. We're done for the second time. But we will be around if you have any individual questions.